If you are suffering from rheumatoid arthritis and also suffering from this bone-crushing fatigue, this video is for you. You might be tired of hearing from your doctor that your RA is doing well, but deep inside you don't feel well. You are still suffering this fatigue, which is not letting you enjoy your time with your family and friends. And one of the main cause for this symptom is the rheumatoid arthritis fatigue. So in this video, I'll talk more about what is rheumatoid arthritis fatigue, how do we manage, and what are those triggers that we need to avoid. Stick around. Before I go deeper, don't forget to subscribe and like our videos so that more of you RA warriors can find those videos. Also, please accept my gift for this holiday season, and that includes a free copy of our The Holistic Rheumatoid Arthritis Guidebook. And I have also created a special recipe for you. That is the No More RA Pain recipe. And that includes a smoothie that you can make it every morning to fight against rheumatoid arthritis as well as the fatigue. Hello, all of you RA warriors. This is Dr. Ananta, your rheumatoid arthritis coach at TheRheumDoc. Today, I am going over an important topic in rheumatoid arthritis. That is the rheumatoid arthritis fatigue. Now, one of the first questions that you might have is, what is this rheumatoid arthritis fatigue? Now, many people feel different type of symptoms when they feel fatigue. And I describe this as this heavy body sensation in your body. You might be feeling as if you are walking through a wet sand. You have this loss of energy to do anything. Even though you get good sleep, you feel that you don't have that energy in your body. And some people even describe a deep sense of brain fog that could make you feel fatigue. And using an example of your cell phone, it might feel like you don't have enough battery in your cell phone. That is how it feels like. The rheumatoid arthritis make you feel so fatigued that you don't have enough energy to do anything. That severe could be the rheumatoid arthritis fatigue. Now, depending on your body, you might have different symptoms that might feel like rheumatoid arthritis fatigue. Now, the next other important question you might wonder is, how common is rheumatoid arthritis? You might be surprised to see this number. Almost more than 50% of you could have this type of problem. So it's a very common problem among patients with rheumatoid arthritis. But the challenging thing is, we don't truly appreciate the problem of this disease. For example, even as a rheumatologist, when I see so many rheumatoid arthritis patients, sometimes even I don't ask the question, how much is your fatigue? That's why it's very important for you to be aware so that you can make your rheumatologist aware of this problem. Now, let me also walk you through what are the risk factors that can increase your risk of fatigue in rheumatoid arthritis. Unfortunately, it typically causes more problem in females. Now, if you remember my older videos where I talk about how common is RA in females, and on top of it, females are the one who are most at risk of rheumatoid arthritis fatigue. Hence, it become a major problem in women. The other major risk factor is high rheumatoid arthritis disease activity. What does that mean? If your RA is not well controlled, you are at much higher risk of having fatigue. Hence, it's very important to treat your RA very aggressively as a way of managing your fatigue. Now, the other important risk factor is underlying anxiety, depression, or any other mental issues. This condition itself can cause fatigue, and compounded by RA, things get much worse. Other one is obesity. If you are overweight, that significantly increases your risk of having fatigue with rheumatoid arthritis. Hence, we need to understand these risk factors so that we can later talk about modifying these risk factors. Now, let's also talk about why I am talking about rheumatoid arthritis fatigue today, because it's a major problem in rheumatoid arthritis management. Now, here are some of the factors that are so important on why we need to talk about fatigue in rheumatoid arthritis. And one of the major one is it has a major impact in your overall quality of life. As humans, we need to have a good quality of life. We need to enjoy our time with our family, with our friends, and we need to do what we really like to do to enjoy our life. But because of the fatigue, we cannot do those things. So it significantly impacts your quality of life. Now, the other one is your societal impact. And what it means by societal impact is, if you are having rheumatoid arthritis fatigue, you may not be as productive. You may not be able to perform your job duties, and that significantly impact your overall productivity obesity in the society. Now, talking about why this is so important, let me also highlight one of the other important factors is the treatment challenges. If you have underlying RA, if you have severe fatigue, sometimes the management of rheumatoid arthritis become very challenging. Many of our medication that we use, including disease-modifying anti-rheumatic drugs or even biologics, they work very well in managing RA, but they may not significantly impact your fatigue. Hence, we need to find some other ways on how we effectively manage fatigue in rheumatoid arthritis. Now, let's better understand why you are having this rheumatoid arthritis fatigue. Let's understand what is happening in your body when you have fatigue due to rheumatoid arthritis. There are multiple things happening in your body that can contribute to rheumatoid arthritis fatigue. And one of the most important one is inflammation. Now, you might have heard this term inflammation in other videos when we talk about rheumatoid arthritis. In rheumatoid arthritis, the primary problem is your immune system is hyperactive. Your confused immune system is causing inflammation. And when you have inflammation, your body make molecules or protein, we call them cytokines. Now, the cytokines, I also call them tired chemicals. And why I call them tired chemicals is this is the chemical that can contribute to the symptoms of fatigue. We call them TNF or tumor necrosis factor. Other one is IL-6, also called interleukin-6 and IL-1. So these are the chemicals that are contributing to the symptom of fatigue. And if you remember, or if you are on any of those medications for rheumatoid arthritis, you might remember some of the molecules or some of the medication, they block these chemicals that can help manage rheumatoid arthritis symptoms. Now, we also call them sickness behaviors. Now, this tired chemical also make you to feel like sick. That's why I call them sickness behaviors. These chemicals, the cytokines, are the primary drivers of inflammation in rheumatoid arthritis. Hence, when we treat rheumatoid arthritis with these medications, then that can help manage fatigue symptoms as well. But one of the most important thing we need to remember is inflammation is a key driver in causing fatigue. Now, the other important one is the RA fatigue is also due to brain and mood changes. Now, many of you who have rheumatoid arthritis, you might feel fatigue, you might feel depressed and anxious, and that might be contributing to your fatigue symptoms. And what is happening is RA and the inflammation can cause oversensitive stress and pain center in your body, in your brain. When your brain is oversensitive, it can lead to a condition called fibromyalgia, which is another condition commonly associated with rheumatoid arthritis, which is significantly known to contribute to the symptoms of RA fatigue. The RA can directly causing this muscle and fitness problem. And what does that mean? Pain can lead to less movement in your muscles. You'll be less active. You'll do less exercise. When you are exercising less, that can directly contribute to the more fatigue problem. Hence, inflammation leading to muscle pain or decreased fitness of your muscles, causing pain and then more fatigue problem. And other one is medications. Unfortunately, many of the medications that we use to treat rheumatoid arthritis, they have side effects. Particularly, methotrexate is known to have fatigue problem. We try to use medication to counter the inflammation, but they can cause fatigue problem. Hence, is a challenging problem in how we manage rheumatoid arthritis because of this fatigue related with medications. Now, other question that might come up in your mind is what are the triggers for RA fatigue? And I have highlighted some of the most important things that can cause or that can trigger rheumatoid arthritis fatigue. Now, let's start with the most important one. We call active inflammation. We also call flares. Flare are those episodes where your RA symptoms is significantly worse. You have more pain, you have more swelling, and more signs of inflammation. Now, the other one is your broken sleep. You might remember, if you don't get good sleep on those days, you are more fatigued and more achy. Hence, not getting good sleep or broken sleep is one of the major cause of RA fatigue. And then also comes the extra weight. So extra weight or obesity is one of the major contributing factor for fatigue in rheumatoid arthritis. When we talk about how we manage RA fatigue, weight management become an important part of the treatment plan. Now, other comes the stress and worry and the low mood. As we discussed earlier, RA is commonly associated with anxiety, depression, and low mood, which is another common trigger for causing RA fatigue. Now, there are few other conditions or other medical conditions that can also contribute to the symptom of fatigue. And here are some of the important ones. Anemia, where your hemoglobin is typically low. That is a significant problem in chronic condition like rheumatoid arthritis. That can also contribute to your RA fatigue. If you have an underlying thyroid condition where your thyroid is not functioning well, that can also directly contribute or trigger rheumatoid arthritis fatigue. Then comes fibromyalgia, which is another condition commonly associated that can also trigger rheumatoid arthritis fatigue. And last but not the least, the sleep apnea. If it is undiagnosed, untreated sleep apnea can also cause fatigue problem in rheumatoid arthritis. So let's quickly understand what are those triggers, including active inflammation, which we call flares, a broken sleep or sleep-related problems, extra weight that can also contribute to the fatigue, stress, depression, and anxiety is a major contributor to fatigue trigger, and then comes the other medical condition that can also contribute to the symptoms of fatigue. All of you RA warriors, thank you so much for sticking with me so far, and I'm hoping that you have learned something about RA fatigue. And this is the most important section of this video. If you could recall, one of the most important trigger and the contributing factor for rheumatoid arthritis fatigue is active rheumatoid arthritis or active inflammation. Hence, one of the most effective way of managing rheumatoid arthritis fatigue is treating your rheumatoid arthritis with the safe and effective medication. Hence, if we effectively tackle rheumatoid arthritis, we can also tackle the rheumatoid arthritis fatigue. Hence, you need to work very closely with your rheumatologist to treat your rheumatoid arthritis well. Now, you might wonder, how do I do it? And the way we could do it is setting a goal. And the goal for rheumatoid arthritis treatment is to achieve disease remission or low disease activity. And what does that mean? That means you have minimal symptoms, minimal signs of inflammation, and your blood marker are also showing those inflammatory markers being normal, like sedimentation rate and the C-reactive protein. And your primary care doctor, your rheumatologist, will help you get to the disease in remission. And if we get to disease in remission, we can significantly manage rheumatoid arthritis fatigue. Hence, this is the most important goal in managing rheumatoid arthritis fatigue, is to bring the disease under good control. And that is done by using all of those medications that we have discussed in the previous videos. But don't forget the power of lifestyle changes. And going back to those lifestyle changes, don't forget our framework, the NESCAR framework: nutrition, exercise, sleep, stress management, and then checkpoint with your doctor, checking regularly with your doctor, and the blood test, avoiding risky substances like smoking, which can trigger rheumatoid arthritis, and excessive alcohol, and as well as creating a positive relationship with yourself, with your family, and the friends. Don't forget the power of these lifestyle interventions. By incorporating those lifestyle changes and the treatment of rheumatoid arthritis, we can fight this battle against rheumatoid arthritis and the rheumatoid arthritis fatigue. All of you rheumatoid arthritis warrior, thank you so much for being with me today, and I hope you learn more about rheumatoid arthritis fatigue, and I hope it was helpful. Please like and subscribe so that other RA warriors also benefit from this content. And please support in our effort on fighting against rheumatoid arthritis. We have a big goal for 2026 to reach up to 100,000 RA warriors by the end of 2026. So please support us in this mission. And I'll see you in the next video. Bye-bye.